So we're going to open this up to questions, and we'll include anyone that was on the panel. So Arturo and Dr. Madrid, Ms. Patton. So, and we have a hand back here from Dr. Frank. We'll get a microphone for you.
Arthur Frank from the U.S. For our Libby panel, I have a question. I too, when I first got to Libby and looked at the issues of what was going on there, was surprised by this new disease, this minimal pleural disease that actually caused mortality. What I'd like to ask is, in addition to the asbestos, the tremolite that's been identified in the material, there are two other fibrous materials, winchite and richterite. And I was just wondering if there's any activity anywhere to look at the potential disease pattern to either of those or combinations of those, and is there something about those two fibers being looked at somewhat separately or in combination with asbestos that's giving us this unusual pattern that we've just not seen in other asbestos-exposed populations?
Yeah. And Arthur, you raise a really good point. What do we really know about these fibers? As Raja just mentioned, erionite seems to cause more mesothelioma. These fibers may cause a different kind of pleural disease. What's different about them, and what do we know? They are finding fibers like that in Nevada, and it's of concern certainly to that population. And what kinds of protection levels should they be using because of that? What kind of protection levels should we be using because we see erionite here in the United States as well as we see in Turkey? It's a spectrum of fiber, of these amphiboles, and there's not huge differences between a regulated tremolite fiber, between a winchite and a richterite in terms of the chemistry of the fibers. So we need to understand a number of different things about these, about why some may be important. The other issue that you raise potentially is, have we looked for this kind of pleural disease elsewhere? Have we really done our homework in other groups that are exposed maybe to amphiboles in other locations to look closely at those folks that may have this disease as well? So we need to do both, and we need to understand exactly the fibers, which haven't been done well in the past because we didn't use the methods that we have available today to understand what do we know about the chemistry and the shape and the physiology of these fibers.
Get a microphone.
Thank you. Barry Robson, I'm from Australia, and Dr. Flores, your comment about the townsfolk of Libby, and I've followed the Libby saga all these years. We have a chrysotile mine in the state of New South Wales. It closed down in 1989, but had been in the town, this little country town, since 1911. So, trying to get the mine cleaned up, they had a town meeting, and we were asked to go there and present our story to the townsfolk. 80 people turned up, and not one of them was scared of that chrysotile mine in their community. And they had the same words that you just said. They don't mind the mine being there, even though it's closed down. They live in hope that it's going to reopen, and when they clean it up, there's a character running around up in the town saying they can extract magnesium out of the tailings. You know, but they've got the attitude, it's been there all this time, none of us have died from it, but they have, you know, and it just amazes me in this day and age that people have still got that mindset, you know.
Thank you for that comment. Yes, second to the last row.
I'm Patty Lawson. I'm from West Virginia, and I'm with Motley Rice. This is my first conference. I have two very quick questions. One is for any of the doctors. Are there any nutritional treatments currently being involved in the treatment of mesothelioma or any of the other cancers involved with asbestos Lisa Wilson in Connecticut has the Raw Foods Institute, and she served on some national panels with cancer doctors, and I just wondered if any of that was being used in the treatment of these diseases.
And what's your second question?
My second question is for Arturo, and I wanted to ask him where his film was going to be shown, released. Does he have any plans of seeking places to show it in the United States?
Okay, great. So we'll first did Dr. Fennell or Dr. Cameron first? We'll give you a chance if you want to talk about nutritional therapies.
Thank you. I can. Yeah. Well, I mean, I can comment very briefly on nutritional substitutes. I know that there are substances which are being studied currently in relation to stem cell targeting, preventative strategies. We know that curcumin, for example, may have activity in delaying some cancers. There are studies ongoing, actually, to look at substances like that, resveratrol, etc. But the evidence at the moment, I think, is very limited. And so it's hazardous, I think, to make recommendations.
Dr. Cameron? Do you have anything to add?
Oh, thanks. You know, nutrition and cancer is something that's very difficult. It's not been studied really well. We were just finishing editing a book on thoracic oncology, and we were trying to get people to write about this, and it was very hard to find anybody that could write a good section on nutrition and cancer. So it's something that needs a lot more research. But you know, certainly people have tried a number of different things, and it's all anecdotal. So it's just some reports, and if one person, you know, you hear about the one person who thinks that they got benefit, and that's what everybody hears about on the internet. So you have to be a little careful. But currently, there's nothing that I know that's proven in the mesothelioma.
Great, thank you. And Arturo?
Well, we're still shooting the movie. This year we're gonna finish because it's been like personal finance. So till now we're really working to put what you saw. We're putting together for fundings in Mexico, and as soon as we get the funds, we're gonna finish it. I hope this year. And as soon as we got a product, we're gonna look for festivals. But my main idea is to release it on the internet first and actually make it available for everybody. But the question here is, most of the people who sick doesn't have access to internet, right? So the idea is to get together a community in internet and get them to let us bring the movie to these communities that are not available. So yeah, I hope next year we'll bring you the movie.
Great, thank you. I think I saw another hand. Okay, but I think there was a hand back here. Microphone. Okay, Marilyn.
Okay. Hi, my name is Marilyn Amento. I'm from Ambler, Pennsylvania. One comment, one question. My one comment is when I was in 9/11, when I was in New York on 9/11, and we were booted out of the city toward the end of the day, there was that massive cloud that we saw on 9/11 went down the entire eastern seaboard. I watched it from the train, all the way from New York, all the way down to Philadelphia. So there's like a whole new population exposed to the 9/11 asbestos and chemicals. My question, however, is being from Ambler, Pennsylvania, and I equate Ambler and Libby to be very, very similar. How can your expertise in Libby help Ambler? Is there any way that you can pop over there and help us out? Because we still have the mountains, and they're still cleaning up. They still want to build buildings on top of this stuff. Anything you can help us with? You want to take that, Aubrey or Brad?
Well, no, and actually there's researchers in Ambler, too, that are working hard, and they're interested also in learning from folks in Libby. And the issues and the learning experiences about understanding these exposures, what's going on now, what are people being exposed to is really important, and how we went after trying to identify it in Libby is really important to Ambler, and I know the EPA folks are trying to use a lot of those same approaches and methods too, but also working with the community. There's different exposures. Ambler was, I think, mostly chrysotile. Libby has amphibole. It's really important for these folks and the research to try to work together and to draw from both. And going back to this issue, this environmental contamination, it's there. How do we understand, even in Mexico, how do we understand those risks to people And are people still being exposed? And what can we do to break that chain of exposure and make sure that it's at levels that are really safe?
I have a quick question for the doctors, and I see this commonly. It's asked within ADAO, our community, and just personal experience. Having 3 countries sitting on this panel, and Aubrey with the government, have you seen a consolidation of information for clinical trial databases? Because what happens is patients now with the internet will search every clinical trial that may not be in their country, that may not be covered by their insurance, and we have a lot of misinformation, confusion, and desperation. So is there a consolidation of international clinical trials that you see coming? But if any of the other doctors can also comment it, I would welcome that.
Dr. Fennell, do you want to take that?
So as professionals, we tend to use cancer.gov to get a global sense of where trials are taking place. I think I showed a snapshot of the UK Clinical Trials Gateway, which gives us geotagging. So a patient can look at where a trial is taking place local to them. But as far as I'm aware, particularly for mesothelioma, there's not a system that gives you a global geotagged database of trials, unfortunately. That's something that perhaps we could work towards as a community.
Someone else have anything to add to that on clinical trials? Okay. Another hands up. Hold the hand.
My name is Jeff Farey from Australia, and I have 2 questions to anyone on the panel who might care to respond. The first one concerns linkage between asbestos and lung cancer. Medical experts in Australia tell me that their calculation is that for every diagnosed case of mesothelioma, there are at least 2 cases of asbestos-induced lung cancer. And medical experts in the UK tell me that the Australians are probably being conservative, that they work on a figure of 1 to 4. So I'd be interested in the views of anyone on the panel concerning the incidence of asbestos-induced lung cancer. That's question number 1. Question number 2 is, I took it from the presentations this morning that there is considerable hope and considerable progress that's been made in increasing the survival rates of mesothelioma sufferers. But can the panel make a comment, or anyone on the panel make a comment, are we getting any closer to being able to identify a cure for mesothelioma?
Who would like to take either of those questions? Dr. Cameron?
In terms of the asbestos-induced lung cancer, you know, it's a little confounded by the fact that lung cancer is caused by smoking, and smoking has been pretty pervasive, at least in this country and others. And so the 2 together is dramatically higher. So the 2, for instance, asbestos and smoking together increase the risk of lung cancer by at least 38 times. So the 2 together are confounding each other. You know, a lot of people are exposed to asbestos, but these people don't even figure that out because they hear smoking and say, okay, it's smoking, it's lung cancer, that's what it is. So I'm sure it's more significant than people attribute to it, but the exact number is going to be really hard to say, and I don't think there's really any data that I know that says, well, for every case of mesothelioma, there's 1 or 4 or 5 or 6 of lung cancer, but certainly asbestos is a large contributor to the incidence of lung cancer in the U.S. and other countries.
Is there any way to distinguish asbestos-related lung cancer versus other lung cancer?
Not histologically, they're the same cancer, but it's something where if you get it, you find in people's chests, it's not infrequently we find pleural plaques in people's chests where there is no history, at least known, of asbestos exposure, and they have lung cancer, and you look inside and there's benign pleural plaques. So there's certainly evidence in a lot of people that people are exposed, and presumably that's contributing to the lung cancer as well. I just have one comment regarding the cure for mesothelioma. I think one of the interesting things that has been way understudied is we know that people have been exposed to asbestos, and we know the incubation period is as much as 40, 50, sometimes 60 years. and yet there's very little being done in prevention. So we have 60 years to prevent something, and if we know people around Libya and other places and people that have worked in factories in Mexico have been exposed, there are things that we can do to potentially prevent it. You know, if we had a better understanding of the molecular changes that occurred during that whole process, and we can intervene with that with anti-inflammatory drugs or other things like that, we potentially could prevent a lot of these cases. And unfortunately, there's not a lot being done in that area. There's some, but there's not a huge amount of research being done there as much as there is in treatment.
Thank you. So the questions were the kind of the comparison between lung cancer versus mesothelioma cases, and the other cure for mesothelioma. Anyone want to add anything to what we heard from Dr. Cameron?
The one thing to understand when they talk about the different asbestos fibers causing different cancers, especially in Australia, there's a higher incidence of crucidolite use, and that was the asbestos. The way they discriminate between these different asbestos fibers is based on size and shape. And some people feel that depending on the size of the shape gives you a greater chance of having a specific type of cancer. So crucidolite was the one that they were most associated with mesothelioma. And the argument of the asbestos companies was that chrysotile, well, the incidence is so much lower, don't worry about it. But in that group, the lung cancer is high. So I don't know the exact numbers, but asbestos is bad. Whatever shape, form, size, whatever, asbestos is bad.
That's right.
That's right. And I think the main thing that you have to be sure of is to lump all the diseases together. Meso, lung cancer, pleural fibrosis, anything that gives you some kind of process that can lead to death from asbestos needs to be lumped together, and those are the number of deaths from asbestos. That's right.
There's one last comment about prevention. Prevention actually starts with prevention of using asbestos. So, so basically, it's still astounding to me that people can use legally in the United States. In my office, I actually have on the wall a plaque that I went to the local hardware store, and I was looking for something, I can't remember what it was, but on the shelf they had an asbestos gasket sitting there. So I bought it and I put it in my office. You can still buy these things at stores. So it's unbelievable to me that the United States cannot ban asbestos.
Hi, my name's Rob Moore. I'm a filmmaker from the UK. I have a quick question. I'm very interested in what you said, the people who were researching at Libby, when you thought that the ways of detecting occupational contamination, you found that you were using them for environmental detection of environmental contamination, and they weren't sufficient. So I'd be very interested to know, what do you think, with your experience, are the best ways of detecting environmental contamination? What methods?
Yeah. So the challenge is, especially if for soil contamination or solid matrices, in Libya they had the vermiculite insulation that was used in millions of homes, and the fact is it was based on essentially methods that are weight percent, and they're insufficient in terms of understanding what the real exposure is. So if you take a soil, and I use a method of optical microscopy, it doesn't go down low enough to a place where they're still generating levels that are unsafe. So I could disturb the soil, or I could disturb and go in these attics in millions of homes around the country, even though it's less than, they say 1% was the way a lot of products were saying, oh, less than 1%, we don't have to worry about that. Well, less than 1% doesn't mean it's safe, period. Less than 1% does not, less than 1% contamination in a product does not mean it's safe, period. And that necessitates approaches that you can see way lower than 1%. So what we were doing in Libby, and it's been used by EPA around the country, is you go in and actually measure people doing something. You disturb it. You work with the product. You actually measure it in the air. And you have people dig or go into an attic and disturb it and measure it in the air. And if you see exposure, there's exposure. And you can measure it, and you know people are being exposed when they do things. And that's one way of getting at this. So it's really important to understand that people are being exposed to these products. As ADAO and others have looked at products, whether it was kids' fingerprint kits or other things, and if you can measure it in these products, using methods, either if you see it in the material, or you can measure it when people are doing something with it, you see the exposures there. And that's what we have to break. We have to get at that.
We have many questions, but we're going to take one more. But I'd like anyone in the audience to, if you do have a question, to invite them to follow you at lunch or other times during the conference to indeed ask their own questions so no one feels like they're cut off. And also, if you need more information about the Libby study, we have blogged about it, but we're going to be building a page so people can access the information that all of you have and any of the other speakers so that you can find these amazing people. Dr. Castleman, you have a question?
Barry Castleman, United States. Dr. Miller, I heard that there were problems with the quarrying of the rock that was used for road building in connection with erionite exposure in North Dakota, and that the health officials were trying to appeal to the industrial parties and the local politicians to try and get the quarrying to be done in a place where there wasn't erionite in the rock. Has there been any, do you know whether there's been any success in persuading those with power to do something about this, to do some prevention and avoid the erionite contaminated areas for quarrying rock in North Dakota?
I'm not entirely sure of the existing status of the quarries now, but the point you raise is really important, and it goes to even Libby, because there's fibers that are not strongly regulated. And Libby has fibers that are clearly asbestos and has fibers there that have a little bit of chemistry differences. It's still the same thing, causes the same disease, but we choose that it's not being regulated as asbestos. Erionite, similarly, these naturally occurring formations in North Dakota, we're also seeing erionite in Nevada as well. It's being disturbed. And in North Dakota, the gravel that was used on roads, and we saw high levels in kids' buses of erionite, the same substance that causes this, a substance that's very similar to the regulated asbestos, causes the same kind of diseases, including mesothelioma. And the efforts have been to trying to reduce it. But now my concern is in North Dakota especially, they're doing a lot of fracking. And these trucks are going up and down these roads. And the levels of exposure may be very well problematic, and kids may continue to be exposed. I don't think there's enough public health attention being put forth on this issue. That needs to be looked at more closely, and who's being exposed and what are they doing to break that chain.
Very good. Thank you so much, everyone. Really appreciate it. Oh, picture?